You must consult the user manual for the full contraindication list prior to treatment. This video does not replace training led by an authorized specialist. Always read the user manual prior to using the BTL Vanquish Me device. To change the applicators, unhook the cables, unplug them from the applicator, and use the blue button to release the applicator to be changed. Make sure you hear the blue button click when locking in a new applicator into the arm lock. Position the cables as demonstrated. Ask the patient to remove all jewelry prior to treatment. The patient must wear comfortable clothing with no metal parts, like zippers, bra wires, etc. Single-use underwear is preferred. Make sure no clothes cover the treated area. The patient must not use any personal electronics equipment during treatment. Choose a low treatment bed or set it to the lowest possible position if the bed is adjustable. Place the device near low section of treatment bed, as demonstrated. Pay attention to device orientation to optimize cable distance from patient and bed. Position the patient into a semi-supine position, where body creates an open V-shape. Bolster patient's legs to relax abdominal muscles. If your bed does not allow for a semi-laying position, bolster the target tissue to keep fat compact and positioned in active RF field. Unscrew all 3 plastic arm knobs and place the applicator on the area to be treated. At the moment, it can touch the skin. Precisely adjust the applicator position in order to place it symmetrically over the treated area. Check for perfect positioning before continuing the process. First, fix the knob closest to the device, then the one closest to the applicator. Lift the applicator approximately 25 mm and fix the middle plastic knob. When released, the applicator should be situated approximately 10 mm above the skin. Adjust the arm and applicator more precisely if the distance from the skin is not at least 10 mm. The applicator should never touch the skin during treatment. Adjust the cable holder and splitters in order to maximize cable patient, cable device, and cable treatment bed distance. A minimum of 5 cm, approximately 2 inches, distance between cables is recommended. Start the treatment by pressing the start button and dialing up the energy. Desired energy should be selected at the beginning of the treatment. Parameters should be set according to the BTL clinical guide. Instruct the patient to inform you about the level of heat they experience and to immediately report if they feel any hot spots, spots where the heat gets more concentrated. If a patient experiences a hotspot, immediately move the angle of the applicator away from the hotspot area. Do not forget to check the level of tuning. BTL Vanquish treatment should never be uncomfortable or painful. There are 2 preset treatment pauses. Quickly check the skin temperature and for sweat during the break. Any sweat must be wiped off the skin and applicator surface immediately. Skin temperature should be between 39 to 42 degrees Celsius in the warmest areas of the treated zone. Remember, skin temperature drops down within seconds due to body thermoregulation activity. Try to manage the check as fast as possible in order to minimize the loss of therapeutic temperature. Pause the treatment shortly and check the skin temperature if the hot spot does not settle. Skin temperature should not exceed 43 degrees Celsius. Use a cooling pad if the temperature exceeds 43 degrees Celsius, or the skin is dramatically irritated, or the patient refers to a burning sensation. Skin erythema is a normal skin reaction. Following are some common mistakes that may have an impact on therapy efficacy. Incorrect positioning of the device arm. Never run treatments this way. Cable touching the patient. Incorrect applicator position. Not over target area.